A round of applause, please.
Good evening, ladies and gentlemen. Good evening, KORRA members.
Good evening.
And any invited guests, distinguished guests. I say good evening. My name is Catherine Irungu Matuku. I am here representing, I'll do a presentation on behalf of the Health and Environment Sub Committee. But before I start, I'd like to introduce the rest of the team members. So please, could you come up, please? My team members, could you dance as you come? Okay, thank you. So I think you need to hear their voices so they'll speak for themselves. Okay.
Good evening.
Good evening.
Again, my name is Jacqueline Chelangat. I serve in this wonderful committee as the chair.
Good evening, ladies and gentlemen.
Good evening.
My name is Harun Kemani Gekera, also serving in Health and Environment Committee. Good evening.
Good evening.
I'm James Weshanguru Dirango, a member of this committee.
I think you all know me, but we have one member who's here but who hasn't shown up. Where is he? GK? Ishingiri Kuria. Okay, he must have stepped out for a bit. Yes.
Thank you very much. So I think it's very important for me to start by talking about this particular subcommittee. And I think I just want to demystify who are we. So this subcommittee was born early this year, in April 2019, this year, of course. And our ultimate goal is to build sustainable initiatives. In creating a cleaner and safer environment, specifically within our home, which is Kiserian and Ongata Rongai area. And what we believe is that as we do this, we are bringing value not just to ourselves, but it's very important in what we are doing because we're thinking about the future of our children. We're thinking about future generations. So we're hoping whatever we do is going to be sustainable. And one of the ways that we are looking at taking a lot of the initiatives we are doing is to actually go through our partners and building collaborations, very strong relationships with various key stakeholders. And at this point, I'd like to recognize the presence of the CEO, Environment, who is with us tonight, who has been one of our key partners, Dr. James Sankale. Thank you. And a round of applause. I'd also like to recognize the CEO, Health, Ms. Eda Wakapa. Say hello. And last but not least, I'm sure you have seen our very able MCA here, who has introduced himself as part of the team, Waisha Guru. Another round of applause. Thank you very much. So that is part of how we look at taking what we are running as key initiatives within the Health and Environment Subcommittee to our people, to our local communities. Have a look at this picture. What does it tell you? Speaks a lot. Pictures speak louder than words. It is Rongai, it is our home, it is all our home. It talks a lot about our currents, it talks a lot about our future, it talks a lot about our behavior, it talks about a lot about us. So it's a sad picture, but it's a happy picture because it means there's an opportunity for us to change the world we live in. This is why it matters to us, because this world that we are living in and the environment that we live in is very important as we look at several SDGs. I'm sure very many of you or all of you are very aware about the SDGs that we are all looking at towards 2030. So two key SDGs for us is the SDG number 3, which talks about good health and well-being. So as a globe and as a nation and as a continent, we are all hoping that by 2030, a lot of us will be able to have, an environment where we can provide healthy lives and promote well-being of all people of all ages. I'm not going to go into a lot of these statistics. I think they're there on the website for you, you can read. But the key thing around this is that you can see a lot of what we talk about in Rongai today is ailing us when you look at where we are moving towards in terms of achieving our SDGs. These are actually some of the targets. So you look at waterborne diseases and other communicable diseases which are ailing our community. That is one of the areas, of course, that we hope that we can address going forward. Of course, I won't go into maternal deaths and mortalities, but just know that what we're doing in this subcommittee ties into SDG goal number 3. The other one is number 6, where we are trying to ensure the availability of and sustainable management of water and sanitation to all. You just saw the picture there. Imagine that drainage, sewage, drinking water pipes, sewage, all that seeping into your drinking water for households. It's unfortunate that the statistic shows that 1,000 kids die every day from waterborne diseases. We need to look at that SDG. So a lot of the activities we are going to do are going to be around supporting the SDG 3 and 6. We came up with 2, of course, in the 2 areas we looked at is health and environment. So this year, under health and well-being services, we looked at 4 different areas that we felt they were not too broad, and we thought we should focus on. So the first one was to support the strengthening of treatment and healthcare. And in another slide down the line, you'll be able to see what we have done. This means just being able to provide for our communities vaccines, antibiotics, having medical facilities that are well stocked, that have the right facilities and the right members of staff to be able to serve our communities. So all this we don't do alone. We work with various stakeholders to be able to achieve all these initiatives that I'm talking about. The other is, of course, in handling air, soil, and water pollution and contamination. That is obvious, as you have seen. Food handling is another key issue that we felt that we should be able to tackle. Anytime you go to Rongai, you'll see hawking of food, selling of food, and it's normal anywhere. But how do we address this matter? And of course, as we go along, we were looking at addressing and supporting initiatives around new and emerging health issues. Like you all know, cancer has become the talk of town. So some of those are the new initiatives that we're going to be supporting as we go down the line. The other initiative around environment is one that we have also focused on all throughout the year. So again, it's all about water and sanitation management. I think for this one, I'd love to give the county government a big hand in this, because we've seen them do a lot of cleanup in the area of clean water, sewage. We've worked tirelessly together with this team. And please give them a hand, guys. They've done a lot. And when we go down, you'll be able to see a lot of the pictures in terms of how we've been supported by the county government. This doesn't mean we don't have other partners who've supported us, but I must say this has been a day-to-day menace that we have tackled with the county government. The other is, and I'm not going to repeat, the water and soil pollution. Some of this you can look at them interchangeably because health and environment go hand in hand. So you'll find some of the initiatives here are the same on the other side. And the last one is on capacity building around the waste management and programs and activities that we run with the communities around us. So for this particular initiative, I think we have been headstrong with this. We have worked with local communities, we have worked with local administration, we have worked with Nyumba Kumi leaders, we have worked with resident associations, name them. The list is so long, I can't thank you more for this. And we will continue doing this awareness as an ongoing program and building capacity within our communities so that we are able to achieve this particular initiative. I think one of the big ones that was clear and was a success to all of us was the major cleanup that we did earlier in the year in June. And so the idea was to start with, the World Environment Day as our key focus. And we all know that on that particular day is to build awareness and to make communities understand the importance of cleaning our environments. And so what we did is to start with mini cleanups to build the hype towards the actual day of cleaning. So we had 3 days where we had, serious cleaning. And on the first day, we had mini cleanups in an area in Gataka. I think I've interchanged that. In an area called Makaburini, which is in Kaimurunya ward. Waisha, I think you helped us so much in that. Asante sana, Mheshimiwa, for that. It was very successful, and today, when you speak to a lot of those individuals, they understand why we are cleaning the environment, they understand why it is important to them. And so what we have done is to be able to let this program run with the locals. It's not that KORRA or the county government has to be there. So that was one of the very successful ones. The other was in Kericho area, and this is in Ongata, Rongai. We did the same, cleaned on the particular day, spoke to the locals, and built a lot of awareness. And of course, on the last day, which was the big day, we actually had the privilege of having Her Excellency, the First Lady, actually officially flag off that particular event. And I must say, a lot of you KORRA people turned up. Thank you very much for that. It was a success. Give yourselves a hand of applause. And we want to continue doing that. And we want to continue working with you. We have an open door policy. We have strong relationships that we want to build with you. And I know amongst us, we have silent volunteers. I know amongst us, we have people who are able to support the cause of what we are doing, this noble initiative. So, karibuni sana to that, and I thank you for that particular event. So, Chrome, if you can just show us some of the pictures. Here are some of the pictures of the day. As you can see, the First Lady right there flagging it off. Our able chair lady was not left behind. And the rest of the team, as you can see, these are just a few pictures. I'm sure you've been seeing them running, so I won't go into that. Waisha there, struggling with taka. Thank you very much. All right, so beyond that one activity, we thought that it is important for us to go on beyond just one activity. How do we make this a culture? How do we make it something that we think about every day? How do we ensure that our children grow up understanding that this is something we need to do? So beyond the quarterly event, we said let's have monthly cleanups. And these monthly cleanups were basically around the same areas with the leaders doing it. Public awareness, we are doing that. We did that. We were at KBC, we were at MMU, and we were able to, showcase what we are doing. And let me just quickly mention our plan for 2020. So like I mentioned, one of the key things that we are focusing on right now is a medical camp that is scheduled to take place on February 2020. We've identified a donor partner in the US. And what we're focusing on at that time is cataract and laser surgeries. We're going to look at oncology, and we're going to look at general medical care. So that is already something in the pipeline. We are only reviewing our budgets, but it's a done deal. Give yourselves a clap for that. So in February, we have that live. I won't repeat much of this because it's already been said. So maybe we can move to the next. I can't mention everyone here. I wish I would. These are all our partners. We can share these slides with you so that you can just go through them. But in general, we had everybody supporting us and making sure that this day was a success. And this is not a one-day event, it's a process. And thank you very much to these partners who are here, who helped us make this an event, to make this a success this particular year. So as I finish, I'm just saying, so let us change the world. Look at this picture, it's a green picture. And let's move from this to that. There's still a lot of hope. Thank you.